Welcome back, everyone, to another episode of the Fitness Athlete Podcast, powered by the Institute of Clinical Excellence. I am your host, Mitch Babcock, joined again today by my colleague in the Fitness Athlete Division, Dr. Zach Long. Zach, how are you doing?
Doing great, man.
Good. Everything running well with Performance Plus and the Barbell Physio account.
It's the normal craziness.
No one churns out more content and better content than this guy. Every time I see one of your posts, I feel worse about myself. I'm like, I should be making more content. And then I'm like, I'll just reshare his. It's fine. Man, we had a great episode. If you haven't tuned into the last one, check out where Zach and I sit down and talk a little bit about polarized training and CrossFit. You can circle back on where you're getting this episode, whether that's on the YouTube account or on downloadables, Spotify and podcast format. But today we want to chat about something else, something that PTs and clinicians are encountering a lot, the problem that you have, which is trying to help patients accomplish hypertrophy goals. Now, this can come in a lot of forms and fashions. Most commonly when you're dealing with post-operative related issues with your patients. Think post-op ACL, and you're trying to really stop quad atrophy and stimulate hypertrophy in the quad. But a number of cases and patients are going to need hypertrophy from you at some point or another. In my world, in the gym space, I just have people from a personal reason, one or another, in the gym that want to focus on hypertrophy. So mechanisms and understanding how that works in the training space is important. Zach talks at length about this in the Level 2 course. We have had a number of accessory and adjunct programs, notably Guillermo at the Sampler. If anyone was at the 2025 Sampler, Guillermo gave an excellent lecture for us there on hypertrophy. But one thing that we wanted to discuss on this conversation is one of the multiple mechanisms of hypertrophy, which is exercise selection, right? Not so much reps and sets and percent 1RM, but underlying all of that, which exercises you choose and how to get the best bang for your buck from a hypertrophy standpoint with that. So Zach, what do you think PTs most need to know around exercise selection for hypertrophy?
When it comes to muscle hypertrophy, we have to first appreciate that the primary driver of muscle hypertrophy is mechanical tension. It is placing tension on the muscle that you want to get bigger. Now, when you read research on drivers of hypertrophy, you'll also hear people talk about muscle damage and metabolic stress, but more and more research is coming out either questioning how important that is, but certainly saying that mechanical tension is by far the most important aspect of muscle hypertrophy. So when you're choosing exercises, we want things that maximize the tension that you feel on the muscle you're trying to grow. So if you are programming for that post-op ACL and you're programming back squats and their quad is still really atrophied, and they say, all I feel when I squat are my glutes and I don't feel like my quads are getting really fatigued during this, then that's not the right exercise for that individual, even though we think of the back squat as both a quad and a glute exercise. Like, we have to appreciate that there's going to be a lot of individualization in terms of the exercises that somebody feels like produces that tension in the target muscle. And that can happen for a number of different reasons. So for example, your anthropometrics, your body proportions will change how you move during certain exercises. Like long torso individuals, when they squat, tend to lean forward a lot more than short femur individuals. And so their individuals with a long thigh are going to feel squats oftentimes a bit more in their hips, versus individuals with a short thigh are more likely to feel squats hammer their quads and their legs a little bit more. It's not always the case, but you just have to appreciate that there's not a perfect exercise for hypertrophy of this muscle, that a lot of your exercise selection is going to come down to testing exercises with somebody in the gym or in the clinic and asking them, hey, we were trying to hit this muscle. How did it feel when you did this exercise?
Yeah, and there's so many regions that obviously every region this applies to, but when we're thinking clinical, when we're thinking, with patients that we're treating in the clinic, I think of like hip exercises a lot, right? This is one that, you can get caught up in a lot of stability banded, related hip movements. But if your goal, again, in our principle, going back to specificity here, if our goal is to create a larger cross-sectional muscle, we want to stimulate muscle growth in that tissue, then to your point, like being able to apply solid mechanical tension on that muscle, what positions are we in, and then how can I load that with enough tension to stimulate growth is important. And this is where you get caught up in the sexy Instagram world sometimes. Or I saw this thing on TikTok that's supposed to really, I'm supposed to feel it in my glutes a bunch. It's like, well, keep in mind what position you're in. Is that just because it's a novel exercise doesn't mean it's the appropriate exercise selection for the mission we're trying to accomplish, which is hypertrophy of that tissue, right?
Yeah, absolutely. So we start with individualization. I think the next thing to consider from a exercise selection standpoint is, does it have an eccentric and a concentric muscle action to it? When you look at research on that, having both of those tends to do better than just having a concentric. That's why you don't often see hypertrophy programs with power snatches in them. Or a lot of times you won't see deadlifts, because deadlifts, a lot of times we're going to lift it up and we're just going to let gravity take it down. And you would see a hypertrophy program probably incorporate more Romanian deadlifts and stiff-legged deadlifts versus your conventional deadlift, for that reason of the more controlled eccentric portion of the lift.
More time under tension, specifically in that eccentric stretch of the muscle. And the longer that I have been focusing on hypertrophy, the more I'm focusing on the controlled stretch. And you hear experts all the time. One name that comes to mind, Dr. Mike Israetel out of Renaissance Periodization. He's someone that puts out a ton of content as well, like yourself, Zach. And a lot of his content is geared around the hypertrophy space. And you always see him on many of his social media platforms talking about big stretch of the muscle, whether that's the pec, the quads, what movements get us in a position where we can create a big stretch and then a solid contraction, and less focus on maybe, going too heavy, right? Which is where I see a lot of individuals in my gym make a mistake. They think it's all about the bigger weight they choose, the more growth. But oftentimes you've seen the same problem. I'm seeing less range of motion. I'm seeing less control of the movement. I'm seeing less stretch of the tissue, which is creating ultimately less hypertrophy and more risk for potential injury if we're moving it poorly with too much weight. So focusing more on an exercise and a position that allows you to accomplish that concentric and eccentric motion.
Yeah, and with the range of motion, again, being another important consideration here, the research there is really interesting, because the research does tend to show that more range of motion results in more hypertrophy. But some research studies looking at different areas of the body actually aren't consistent with that finding. So I kind of take this big body of research we have now that tends to lean towards more range of motion being better, and say that when I look at a hypertrophy-based program, I want to see that they do put some emphasis on range of motion. But I think we can also get carried away with that. So I think the best example to think of here is in the world of glute training. The hip thrust exercise is undoubtedly, to most people, one of the most effective glute builders out there. Created by Brett Contreras, also known as the glute guy. He has just done a phenomenal job building his entire business around building bigger glutes on individuals, specifically in like female bodybuilding fitness area. Well, the hip thrust is an exercise where we're not moving the hip through its maximal range of motion in terms of hip flexion, and we see the peak amount of force on the glutes when they're at extension, so in the actual shortened position of that muscle group. So don't take this to mean that every exercise you choose has to be full range of motion, but that we do want to see that you're actually training that at least some in each muscle group that you're doing.
Yeah, absolutely. What movements and what regions stick out to you? If you were to, help PTs understand, like, I see this done wrong a lot, like when you're trying to target, like to your point, glutes, or are there other regions that you're seeing PTs try to target and you see common mistakes from movement selection? Are there any that jump out to you specifically?
I think lats a lot. I think that's probably a lot of that is my bias as somebody in the CrossFit space where we do a ton of vertical pulling. But I see so many people, their lat work is rows and row variations and never training the lats in a maximally stretched position. So like my absolute favorite lat exercise of all time is what's called a rack chin. So we've got a barbell placed at about front squat height where it would be racked on the J cups, and we're hanging from that barbell with our feet elevated up on a box. So now our hips are really flexed with our shoulders fully flexed, which is going to put the lats on maximal stretch. And that absolutely crushes the lats. But if I'm training lats, I do want a lot of my range of motion to be going from fully overhead, full flexion towards extension. The other area is the quads. Like, I'm not anti-TKEs. I think they're a great rehab exercise at times. But man, if you want to really hammer the quads, you need to be hitting full depth squats. You need to be hitting lunges, sissy squats, cyclist squats. I think those are a huge key to developing quads long term.
Yeah, 100%. Like, get those heels elevated, get into a deep, full knee flexion range of motion at the bottom, and really stimulate, to your point, that full range of motion of the quad, as opposed to the TKA. We're just working that top 20, 30 degrees of knee extension. Let's get a wider range of motion. Yeah, another one that comes to mind is something we talked about. This is like a single leg RDL, right? Where individuals are struggling with balance demands more than they are struggling with the load and focusing on the range of motion. And because they don't have solid balance, they end up reducing the load to a degree where they can focus on balance concerns, versus if you just modify that movement to, remove the balance component, give them a handhold, let them hold on the rig. Well, now that balance is off the table. I can adjust loading to a point where I can control concentric and eccentric variables, time under tension, and actually stimulate the hamstring, which is ultimately the goal. Like, if your goal is to create hamstring growth, then put the individual in a position where they can most accomplish that.
Yeah, it's almost like there's an inverse relationship between the mechanical tension you can place on a muscle and the stability of the exercise.
Yeah,
if you're
100%.
standing on a Bosu ball trying to squat, you are going to be so focused on balancing on that Bosu ball that you can't place maximal tension on the target muscles. Or the single leg deadlift is my favorite example of this. Like you mentioned, it's if you're having to work on your balance, even just a little bit, you're going to reduce the amount of force and tension that you put on that target muscle. And so small little steps to increase stability is going to be huge. And I think this is a huge reason why you see bodybuilders use a lot of machines in their training. They want to minimize the stability so that they can maximize tension on those muscles in a hypothetically safer position for them, since they don't have to have a spotter and things like that. But they focus greatly on max stability on their lifts.
Something that I learned from you way back 10 years ago as a student in clinic, but also that has rang true with almost every single fitness athlete individual that comes to see me for care. They can have a long training knowledge. And sometimes as a clinician, you can feel the pressure of needing to, show them a new exercise that they've never seen before. But almost every single time, it's finding a variation of an exercise they've already done that they're doing poorly and finding a way to help them do that variation better, right? Like, I don't need to show them a different type of pull-up. I need to help them understand the goal of the pull-up right now. And if the goal is to develop lat strength, to your point of modifying that to that rack pull-up option with the feet elevated, or going with a single leg lat maneuver overhead where we can feel a big stretch on it, or we can target the hamstring in a better position. It's not that the individual's never done this movement before. They have just lacked the clarity around why they're doing it. And so the more that you can spell that out for them, hey, right now, what I see a problem with is that we need to create bigger hamstrings, bigger glutes, fill in the blank, right? And the way we're going to focus on that is making all of our training not around how much weight you can move or how fast you can do it. Wink, wink, CrossFit athletes. It's about the intent, the control of the movement to create mechanical tension on it. And over the next 6, 8, 12 weeks, our goal is to create a bigger muscle. There will come a time and a place where that bigger muscle can be stronger and more powerful, and we can talk about moving heavier loads faster. But right now, this is our focus. And just providing more clarity around that, I think, helps patients a lot more than maybe clinicians are giving merit to.
Absolutely. Yeah. I think that the next thing I really like to think of when it comes to exercise selection is, you mentioned we want to progressively overload this over time. And you've got to choose exercises that allow that to happen. And if you're choosing really isolated exercises, a lot of times those will have less ability for that progressive overload. So like I'm treating a distal triceps tendon tear right now. And this guy, after his surgery, is just not progressing the way that he wanted to. And we look at what he's been doing from an exercise selection standpoint, and like his program has been really based around tricep kickbacks for a while. And when I ask him about, how many reps can you do now versus what you were doing 3 or 4 weeks ago at the other rehab place he was working at, he can't do that many more reps. When I ask, how much has your weight progressed? It hasn't progressed over the last 6 weeks. That's just a really poor exercise to use. And I'm sorry, I don't have a formula for you on this in terms of what exercises are good from a progressive overload perspective or not. This is one of those things that like you need to be in the gym testing different stuff out yourself. But a tricep kickback just sucks from progressive overload compared to a skull crusher or a close grip bench press or some exercise like that. This is like really, really crucial when it comes to hypertrophy.
Yeah. And if you're a PT student listening to this, or a novice clinician first couple of years in the space, this is where being in the strength and conditioning environment, being in the gym yourself really pays off so much. You don't realize how much your breadth of exercise knowledge is improving by going through a strength program, by having a coach, by having a personal trainer walk you through a lot of this development so that your breadth of knowledge to be able to pull what Zach just mentioned there, 4 or 5 tricep specific exercises that he pulls from his years of being in the space training, right? Let's use a skull crusher. Let's use a French press. Let's take it overhead and work greater range of motion. Let's work the tricep in a position and a movement that allows me to progressively overload it over the next 6 weeks versus a tricep kickback that I'm going to be stuck with a 10-pound dumbbell, until the end of time. It's not the problem. And so, man, just a big advocation there for getting some personal experience under your belt to apply these principles with a lot more ease.
Yeah, another area that really you have to be in the gym to feel is the stimulus to fatigue ratio of exercises. And this is, again, it's just another kind of abstract concept. This comes from Mike Irzotel of RP Strength, who you mentioned earlier. But the stimulus to fatigue ratio, we're talking about how good is an exercise at creating mechanical tension in a hypertrophy stimulus relative to how much fatigue it puts on board. So if we think about this, if we keep on like hamstrings, for example, a Romanian deadlift compared to a seated hamstring curl. They both are going to create a great stimulus for hamstring growth. I would bet that probably the Romanian deadlift does that a little bit better. I don't have a research study to prove that, but that would be my bet. But it also comes at more fatigue. There's a heavier load, there's axial loading. You can't tolerate as much volume of Romanian deadlifts as you can a seated hamstring curl. And one other thing we do know about hypertrophy is it's very volume related. More volume results in more hypertrophy. So you have to be familiar with exercises and how draining they make you feel so that you can understand how much of this can I program on somebody so I make sure I get them enough volume to continually progress that hypertrophy, but I'm not just trashing them with 20 sets of deadlift a week.
So easy to do. And I've programmed for a number of athletes individually in the gym that are looking for various goals that have a hypertrophy component to it. One in particular that wanted to really develop, let's just say the posterior chain specifically, right? And you can find a great workout. For example, we did a workout that had a number of, calories on the echo bike to fatigue the legs, and then walking lunges. And if you've ever done weighted walking lunges at moderate volumes at all, let alone high volumes, you know that the soreness will linger for a bit. It's a great workout, but you need to recognize the fact that the next 2, possibly 3 days are potentially a wash when it comes to being able to retrain that muscle group again. And so you have to weigh those considerations in terms of when are our rest days, when are we hoping to train this muscle group again, how much fatigue is going to be associated with it, and whether or not it's the right exercise at that given time of the program.
Yeah, bringing up soreness is another good conversation around hypertrophy and exercise selection. So soreness is not necessarily a great indicator of if you had an effective workout or not. And that is because of what's called the repeated bout effect, where the more frequently you see a stimulus, the less muscle damage it creates, but it still creates a positive stimulus in terms of hypertrophy. So if you think through that athlete that did echo bike and lunges, If they did that same workout again a week later, they wouldn't get as sore from that workout. And if they did it another week later, they might not get sore at all. But that doesn't mean that it became less effective of a workout. It just means that their body has kind of adapted to that from a muscle damage perspective. And so at times that might mean if you're going to play with a spicy exercise like lunges that could create soreness for a few days, you start really low volume with it. Like maybe we only do one set in a hypertrophy program week 1, and week 2 we progress it by going to 2 sets and then 3 sets, etc. But one thing that we see a ton of in our level 2 course, fitness athlete level 2 course, in the week where we have people actually go about writing a strength and hypertrophy program, is we as PTs are so used to adjusting exercises frequently because somebody comes in week 1 with like highly irritable back pain and they come back next week and their symptoms are 30 to 50% better. Well, they're not doing the same exercises. We're taking a good progression up in their exercises. And so we're used to changing exercises a lot. But when it comes to hypertrophy, we probably don't want to do that quite as frequently because then we're constantly creating unnecessary soreness without getting a necessarily better workout because of this repeated bout effect. And so I want people, when it comes to hypertrophy, choosing the exercises that they like because of all the variables that we've already discussed and progressively overloading that for 3, 6, 8, 10 weeks until we start to see things not being able to progress anymore. Then we deload and potentially change our rep scheme, change our loads, or change the exercise. But don't get in the habit of feeling like every single week the workout program needs to look drastically different.
Man, I fight this constantly when writing programs. I'm like, we just did that, right? Like, let's mix it up. But I have to anchor back in this reality of like, hey, we just need more of the same thing. And I challenge myself to like, let's say I have these 4 movements in this bucket, and these are the 4 I want to really hammer and stick with. And then I'll just play around with the order and presentation of those movements. And so I'm keeping some novelty in the way it's exposed to the athlete, and yet keeping stability in the exercise selection and progressive overload by the stance of like, well, it's still more hip thrust. It's just paired differently with a different secondary or tertiary movement so that it doesn't feel like the same circuit that you went through last week. And so that's my way of trying to keep it fresh for individuals while still maintaining this principle of like, we don't necessarily need more novelty. We just need more progressive overload, and we need to hold the course for a couple more weeks.
Absolutely. It's a tough thing for those of us that are PTs, especially PTs that CrossFit, because we are so used to constantly varying that we kind of feel like we're cheating the system if we're not constantly varying, but we're training for a different stimulus here.
It does spoil us of like, why is this? I just did this workout. And it's like, well, it's a different stimulus, right? Or it's a different goal right now.
Yeah.
Anything else to add, Zach, when it comes to exercise selection that you think PTs should know and could apply very rapidly? They don't need a whole lot of time to study this up other than reconsidering the ability to create tension and stretch on a muscle. What do you think?
I think the final thing when it comes to hypertrophy to consider is just safety. We know from a hypertrophy perspective that training closer to failure creates a greater hypertrophy stimulus overall, but you got to choose exercises that you can safely go close to failure. And you have things set up pretty well for that. So I tend to go really close to failure on more of my isolation exercises in a hypertrophy program. And I tend to keep a extra rep or 2 away from failure when it comes to like, I'm not programming a back squat to true failure. Even if we have safety pins, like it's just not worth it for those extra 2 reps. We're going to stay 2 or 3 reps away from failure. But when it comes to leg extensions, like, yeah, I want you to go till you can't do another repetition here.
Yeah, rotator cuff, burnouts, side lying, external rotations. Something else that goes well with that, landmine press, right? Like a failed landmine press, your other arm is right there available. You're already kneeling. You set the bar on the ground. So it becomes a very presentable exercise to take to failure. And to your point, using reps in reserve for those other ones. Hey, I want you to stop when you feel like you only have 1 rep in the tank. Feels better for the patient anyways to be like, cool, I can do that. You're not asking me to kind of dance in dangerous waters here. And I can respect and appreciate that.
Yeah, I think that hits it from an exercise selection standpoint. If you're keeping all of that in mind and then just regularly going back and testing, whatever your objective measurements are here, you're going to get people bigger and stronger.
And boy, do we need more of that, man. When it comes to looking at creating fitness forward providers, helping individuals, helping PTs create bigger muscle, so hypertrophy, create stronger muscle from a strength perspective, and then creating fitter humans. I mean, those are really the main pillars that we're teaching to constantly. And if you take our coursework, you hear us saying a multitude of these things in a variety of different ways. But again, I just want to point out that if you want to dive down the rabbit hole of all the mechanisms that really pull the different levers of hypertrophy for your patients, you're going to find all that information in our level 2 online course. You need to take our level 1 course to qualify for that. It's kind of a prerequisite. And then we'll pass you over to Zach, where he can dive into some of these principles of hypertrophy and really refine the way you're delivering that to your patients. But Zach, I appreciate your time. And to everyone listening, thank you for your time. We would love it if you liked and shared this with another clinician or a coach that you know, if you found it valuable. We appreciate you making us a part of your daily listen. And you will find us next time at the Fitness Athlete Podcast. Thanks so much.